Hello, my name is Mary Ciccarelli with the Indiana Complex Care Coordination Collaborative at Indiana University School of Medicine. I'm here to ask you to consider using a toolkit to help teach health and wellness to your patients with intellectual or developmental disability, or IDD. We want to introduce you to the Healthy Habits worksheet and its accompanying handouts and action plans located on the website forourhealth.org on the Fitness and Health Habits page. This worksheet has been built in collaboration with Special Olympics Indiana and has been well received by many patients at the IU Eskenazi Center for Youth and Adults with Chronic Conditions. We hope you give it a try. Many persons with IDD struggle with health and wellness self-care. Causes may be a lack of education about healthy practices, lack of support and needed skills, trouble remembering to perform daily tasks, or lack of caregiver support. Many of the persons with IDD we encounter as health professionals are struggling with comorbidities related to inadequate health habits. We see urinary overflow incontinence, chronic constipation, overeating, choking with eating, poor hydration, nutrition or hygiene, sleep disruption, and physical deconditioning. 4 major health issues called the Fatal 4 that are commonly linked to preventable death in persons with IDD are aspiration, dehydration, constipation, and seizures. These can be related to eating too fast or swallowing overly large bites, inadequate daily fluid intake, ignoring stooling frequency, and failing to recognize seizures. Many patients with IDD do not effectively read their body cues or adjust to them. Cues like thirst, hunger, satiety, bladder or rectal stretch, sleepiness, all might be missed or misread. However, if you insert reminders, the person may not be as dependent on recognizing the body cue. One example is providing a preferred bedtime in order to get enough sleep for a planned wake-up time. Another example is setting a pre-established goal of how many glasses of water or servings of fruit, veggies, or protein you will eat in a day. Timed voiding reminds you to go to the bathroom at specific times throughout the day rather than wait until it may be too late. Establishing a routine for physical activity and exercise is important for everyone. Patients with IDD may benefit from creating a specific plan on how often they will bathe, brush their teeth, change to clean clothes, trim their nails, etc. We all can improve our self-management if we practice good health habits. These are rules we tend to set for ourselves and follow on most usual days. Remember that we want to encourage the dignity and respect of each individual's ability to manage themselves while also making it easy for them to do so. Specifying usual day rules for mealtime, servings of specific foods and glasses of water, exercise minutes, toileting time, hygiene activities, bedtime, and wake-up time support individuals with IDD in managing their everyday activities. The website toolkit is called Healthy Habits. The tools are designed to empower persons with IDD and their caregivers to define simple and concrete rules for personal health habits, and then teach, reinforce, and habituate them without expecting individuals to do so in a rigid or perfect way. We all choose not to follow our own health habits on certain days. It is important to afford the same choice and dignity to our patients with IDD, and they may need to be taught the nuance of how to approach unusual days. The toolkit contains a basic worksheet, action plans, and reminder tools, as well as introductory handouts for self-advocates, family and caregivers, and healthcare teams. There's another set of handouts for managing and supporting individuals in creating habits and then navigating unusual days. As health professionals caring for persons with IDD, it is recommended that you should screen the current state of health habits and recognize early warnings and consequences of inadequate self-care. You will likely find that dental hygiene, nail care, toileting, and bathing habits are all common areas of difficulty. When you encounter these concerns, we hope that you will think about health habits and share the tools with your patients. There are also a number of extra help for caregivers handouts, which suggest adaptations around a number of particularly difficult issues, such as using special toothbrushes or special methods for reaching toileting hygiene. Thank you for watching. To assist your patients in learning to use health habits, you can refer them to the partner video at forourhealth.org as well as the worksheets and handouts on the Fitness and Health Habits page.